Thank you, Dr. Sultana, for that kind of introduction. So Einstein have to provide a quote from Einstein. He said, imagination is more important than knowledge. Imagination is everything. It is the preview of life's coming attractions. So I would like each of you to have this following imagination. Imagine a world where every patient, regardless of geographical location, race, earning status, attitude, or cultural barrier, technological barrier, or put together the great barriers, will have access to timely and state-of-the-art, world-class comprehensive cancer care. It's a dream. And I'm a physicist, we like to dream. We are going to transform cancer care globally and accomplish this goal. And Bangladesh will be part of this initiative. So we'll create a platform which we'll call Vision AI, or Virtually Integrated Solutions in Oncology, powered by artificial intelligence. It's a cloud-based platform, and the really goal is to really democratize access to high-quality cancer care across the cancer continuum, from prevention to diagnosis to treatment and palliative care, complemented by virtual clinical trials and harmonized oncology education, all powered by artificial intelligence. Can this be done? Indeed, we'll make it happen. And why is it that we'll be able to make it happen now? Because in today's world, we have access to many advanced technology. This will be a technological revolution, if I may say so. We now have access to cloud computing, artificial intelligence, multi-omics, robotics, Internet of Medical Things, big data analytics, data integrity, and many new centralized and portable medical technologies. And most importantly, we have formed a consortium of partners ranging from academic institutions, AI companies, faith-based organizations, and others. And this will be a joint initiative between United States government and Bangladesh, if you will. And I'll show you a mind map of the entire process. So here is your Vision AI in the center. And to start this project, we'll need some funding. This is where US government comes in. And we'll need to have global collaboration. We'll have to put together a lot of the processes and then, of course, the artificial intelligence. We'll have to identify all the different barriers. And we'll have to build the infrastructure, put together clinical trials, and you just heard about omics. You need to have a good omics integration. And the result of all of that on patients will be patient empowerment, early detection, equitable cancer care, improved survival rates. And the other impact on patients will be research and innovation, efficiency in all the processes and improvement on them, and cost cutting, and also global collaborations. So all of these we'll have to put in on the cloud. And we also call it a comprehensive cancer center in the cloud. Here is a pictorial representation of what I mean by this. Imagine now, on the upper left is a cancer center. That's my cancer center in the US. We'll take a center from Brazil, in Brasilia. We'll take a center from Ghana, take a center from Middle East, and of course Bangladesh, covering different continents. And they all will be connected through the cloud, okay? Simply speaking, everything that we do to take care of cancer patients on the ground, almost everything, except say, for example, an imaging machine or treatment machines, everything else we should be able to do in the cloud. And the goal is to bring each of these centers at the same level and make them world-class cancer centers. So every patient close to each of these centers will now get world-class cancer care, state-of-the-art. And so if Bangladesh will become, we have plans to take NICRH as one of the centers, and when we met His Excellency Dr. Yunus, this is something we presented to him and sought his support. So the goal will be, say, for example, when this center becomes the state-of-the-art, which we think will happen in about 3 years, then that anchor center will now be connected to, say, 8 other or 10 other centers across the country. A center from Chittagong, Bogora, Sylhet, Mymensingh, everywhere. And then we'll bring all of those centers to the same level as this anchor center. So all those centers are now, suddenly each of these 5 centers are connected to 50 centers in 5 years. And they're all performing at the same level. And in 8 to 10 years, 50 centers will become 500 centers. I was born in Noakhali. So a patient have a cancer in Noakhali wouldn't need to come to Dhaka to get his or her cancer care. That patient will have access to some of the best physicians or other professionals from Harvard, from MIT, from you name it. He'll have access to all those oncology professionals and get the best quality care. That's the goal, and that's what we'll accomplish. So what does that mean? That means that we'll have to place a lot of processes on the cloud, and I've listed here some. You have to have point-of-care initiatives. You have to put in medical oncology in the cloud. You have to put radiation oncology, surgery, radiology, nursing, genetics, palliative care, pharmacy, nutrition, psychology, psychiatry, social work. All of them will have to be put in the cloud and integrate all of them. Seems like a daunting task, but it can be done and it will be done. So suppose now we accomplish this goal. What does that mean? How do we know we have solved the problems? So here is, I just talked about the barriers. And in the Lancet series, we have published a lot of the barriers in the SARC region. Now, let's say that one of the top barriers, under the great barriers, is the lack of early detection. And if this, what I'm proposing, works, then we should be able to overcome this. And how are we going to do this? Why do our patients in rural areas do not seek medical care? There are many reasons. One may be that they do not have access to the care, or they don't believe, they don't trust the professionals taking care of them. There is data to show this. Or they don't believe the test results that are coming, right? How can you address, if those are the problems, how can you address the problems? There is no cancer care facility close to them. As we know, if Muhammad doesn't go to the mountain goes to Muhammad. So the patients are not coming to us. Let's go to close to where the patients are. How can you make that happen? So for example, we can have now mobile trucks. We can create a community center in the village, and we've staffed them with the people from the community who train them. So the people in the community believe them, trust them. And so when we train them, so we can say, for example, have a mobile truck that can have all these different, a mammography unit, an ultrasound unit, a colposcopy unit, all of that you need. And then there are a lot of physicians in the audience. I'm a physicist, right? So you prescribe all these different tests. There are now portable devices powered by artificial intelligence, that can produce results of this test in less than an hour. Yesterday, I met a physicist, a young physicist from Bangladesh, Alamgir Kabir, I think his name, at Jahangirnagar University. I see he's raising his hand. He has already created a device like that. And I asked him to start a company and give me a small share of that. And so there are opportunities. All these devices actually can perform all these tests, and you get the result in less than an hour. We've improved access, right? Now, suppose a patient needs HPV testing. During the COVID time, we've learned how to stick this thing in your nose and you get the results, right? So if a patient comes to this community center, you provide the patient with a self-test kit. And the staff is trained, patient knows what to do, and then you have these devices, point-of-care devices. You perform the test, in an hour you have an answer. If the patient now, once the results are in, if the patient needs some colposcopy, we have a unit there to do the testing. We can do an ablation test there. And if the ablation test we cannot do there, then we have the AI database that will know where the patient lives, and close to that, patients where the patient lives, what is the next center where the patient get that particular treatment. And the AI solutions, and we have partners in this initiative, these AI solutions will tell the patient, you have an appointment with Dr. such and such on Monday, January 15th at this time. Go and get your test done. So by doing this, we've really downstaged the patients, this disease. Now these patients come with a stage 4 disease with poor survival. Now I've downstaged them. They'll become possibly a stage 1 disease, improve survival, an impact on economy. How can you do surgery in the cloud? So here are some ideas. Suppose you have access to a Da Vinci surgical system. This is an ICRH. A surgeon here is doing an operation, and they have access to Da Vinci system. This is my center in the US. And these are two centers. Dr. Azad is here in Chittagong. We have heard him, the great work that he is doing, right? He wants to train people. He has access to those, right? So now, when a surgeon is doing this operation here, surgery, a surgeon remotely at my center can provide guidance real time, how you're doing the surgery. And Dr. Azad's trainees can watch real time to see how the surgery is performed. So we are able to train our people. And then there are 3D printing. Suppose there's a patient coming up a week from today, and the surgeons can, for a heart surgery, and with this 3D printing of the heart of this patient, the surgeons now will be able to practice for a week on how to do surgery on this particular patient. And after that is done, when the patient comes, real time, and now the surgeon is expert on the patient's information and do the surgery. Then you hear about virtual reality and augmented reality. With augmented reality, when a surgeon is performing the surgery, the system will actually help the surgeon. You're not doing the suturing here right. We are going in the wrong direction. So all of this technology will help us, our surgeons, to how to become really an expert surgeon. How are you going to use this vision AI that I'm talking about? Our medical oncologist colleagues, help them to prescribe the right drug for the right patient at the right time. So this vision AI will provide many capabilities. It will help our medical oncologists to stratify the patients when they see a patient, right? It will help them to adapt prescription. We talk about adaptive radiotherapy in the radiation oncology world. But now with this AI system, the platform that I'm proposing, will be able to tell the physician that you will be using this drug for this long, then you'll be using a different drug as needed, depending on the response of the tumor for a particular drug, and really do the adaptation. And it will do all of this by combining the information from different omics. You have just heard Dr. Saraswati talking about having a great omics team. So that's what it will do. And how will it do that? So say, for example, this Vision AI platform will combine information from all the different kinds of omics, your genomics, your transcriptomics, proteomics, pathomics, radiomics, all the different omics that there is. Okay? And then all these different omics will help the medical oncologist to decide what's the right drug and what may be the combination of drug. And so really, and which drug the tumor is sensitive to that or resistant to a particular drug, right? So it will combine all this omics information and really, truly what will be a personalized medicine that we talk about. And let's just take a couple of minutes to talk about what some of these omics do. In the genomics world, we do this genomic testing and say we look for different mutations. So if you have a non-small cell lung cancer, you are looking for, is there an EGFR mutation? Or if there's a melanoma, you're looking for a BRAF mutation. And if you have those mutations, then you know what targeted therapy to prescribe for this particular patient. In the world of transcriptomics, what happens is one looks at the changes in the gene expression in response to the drug therapy and really which looks into the underlying molecular mechanism that provides information about the sensitivity or resistance of that. So it really performs an analysis of a complete analysis of different RNA transcriptors of mRNA and provides that information whether a particular drug is sensitive or resistant. In the radiomics world, one looks at you extract various quantitative features from different imaging information as a patient undergoes treatment. And that provides information whether this particular tumor is responding to that. In pathomics, one performs an evaluation of tissue architecture, cellular morphology, molecular features, tumor microenvironment, and spatial relationships, say, for example, in the interaction between tumor cells and the immune cells, right? It really bridges the gap between traditional your pathology and advanced computational techniques and provides you information at the granular level about the disease. So how are we going to do all of this? What shall we do when we have all this information? What will this Vision AI platform do to help the medical oncologist here? I have 2 minutes, 30 seconds. So the goal is, AI is data. We'll collect, say, for example, data from 2,000 patients with all these omics. Then we'll model. We'll develop all this AI modeling. And with this AI modeling, we'll test the model. And then once the model is tested, when the next patient comes, then that information, this model will help the medical oncologist to decide if a particular patient, a tumor, is radiosensitive for a particular length of time, and then it's not radiosensitive anymore, it becomes radioresistant, but then it's a different drug that can be radiosensitive. So you will be able to really do a combination of different drugs to help the medical oncologist to do appropriate adaptation of what drug to prescribe, right prescription for the right patient at the right time. Radiation oncology world, this is what I do. We know what happens in the radiation oncology world. A patient comes in, sees a physician, radiation oncologist, decides to treat the patient, you do scanning, and after the scanning, the physician goes and does all the contouring, writes a prescription, a physicist or a dosimetrist does the treatment plan, physician approves them, and you do a QA, and we treat the patient. That's the process. So now, as soon as the scanning is done, we are now using this AI-generated software. The software automatically does all the contouring. And they're becoming so mature that they can actually contour the target. And they're able to say it's a particular staging of lung tumor. Once it knows that, then there are templates. You can create 5 plans. And the QA plan is done right away. Sends a message to Dr. Govinda Babu or another physician, hey, your plan is ready. He's on vacation somewhere, but now he can remotely log in and review the plan. The plan looks fantastic. My God, this is good. Or if not, he can actually make some edits to the contours, prescription, and the plan is done. Or he may want to do a peer review with somebody from Harvard. So we can call the patient, have a contact with the physician at Harvard, and do a peer review. So a patient in my hometown now will have access to a physician at Harvard if there's a need. And once those are done, then we'll have this AI software that will actually tell the patient when the scanning is done that your treatment will be at that center that is close to your home. There are 4 machines at that. You'll be meeting Dr. Blau, so-and-so. At 4 o'clock will be your treatment. They'll all be done. And all these technologies currently exist. So, this is what I just said is shown pictorially here, all the different processes. So we can automate almost everything except the planning and the treatment. So to summarize, Vision AI will integrate advanced technologies and revolutionize cancer care globally. It will democratize access to high-quality diagnostic and therapeutic services and other supporting services. It will overcome the geographic, economic, and other barriers. It will establish a sustainable and scalable healthcare model. It will foster collaboration and commitment to equity. And most importantly, it will create a future where all individuals, regardless of their location, will have access to state-of-the-art cancer care. And this is our dream. You have seen these 3 musketeers. The 2 others are actually on their way back home. And we are in it together. And I have a friend sitting right here, Dr. Gustavo Oliveira. He's an important member of the team. And so together, we'll accomplish this in 5 to 10 years. And we talk about collaboration, and we'll need the collaboration of all of you to make this happen. Thank you very much.